another episode of Youth Diary. Sexually transmitted diseases are infections that you can get from having sex with someone who has the infection. It spreads from one person to another through intimate contact. So let's know more about it. So we have Dr. Faizal with us. He's a consultant dermatologist from Ernakulam. Hi Doctor.
Hi.
Welcome to our show. Doctor, can you just explain what are sexually transmitted diseases?
See, sexually transmitted disease is also known as venereal disease. This, it can be caused by bacteria, virus, or fungal. There are many. There are different types of sexually STDs. This more common. It is gonorrhea, syphilis, donovanosis, LGV, lymphogranuloma venereum, and human genital warts, herpes progenitalis, HIV, all are sexually transmitted diseases.
Is it spreads only through an intercourse or some other way also?
No, it's most commonly it's spread through the transmitted through the sexually contact only. But it can be transmitted through the skin to skin contact, blood to blood contact. Even it can spread from infected mother to baby through the placenta during the pregnancy.
So it's not only through the
sexual contact. Yeah.
I think our friends have got a few doubts.
Yeah, okay.
Let's move on to that.
Hi ma'am, I'm Meera from Dublin Healthcare. Is there a possibility of getting STD from a non-sexual intimate contact?
Yeah, most commonly it will be spread through the sexual contact only. But it can spread through the other route also, like skin to skin contact, blood to blood contact.
Skin to skin contact means
rubbing together that infected persons that can be rubbed. Then that like that.
If there is any wound on the skin or something. And then what are the other ways, doctor?
Blood transfusion.
So is it possible to get through a blood transfusion? I mean.
Yeah, HIV will be transmitting through the blood transfusion.
Oh, will it be present in the oral secretions?
Yeah.
So that means
chances are that if there is any cut wound and all, it can be, and the herpes labialis can be spread from the kissing and so.
That means if a grandfather is having an herpes labialis at home,
if
what are the chances of getting?
There are chances of getting
infection
to the kid.
So we'll move on to the next question.
Hi ma'am, I'm Sri Priya, working in Dublin Healthcare. Ma'am, is there any chance of getting STDs from toilet seats?
Actually, there is no chance to get STDs from the toiletries, but it can. It's very rare.
So sharing a public toilet or it's not at all. So doctor, what are the chances of getting an STD by sharing bath towels?
Say, some parasitic infections like pubic lice, scabies can be spread through the sharing the towels, bed sheets, and clothings and all.
Doctor, one more doubt here. I've seen most of the guys sharing razors. So is there any chance of getting STDs through that?
Yeah, that should not. That can spread the STDs.
Is it mainly through the blood?
Blood.
So doctor, the scabies, is it a sexually transmitted disease?
Actually, it's not. It's a communicable disease, but it can be transmitted through the sexual contact also.
So when we go to the sexually transmitted disease, can you just explain me what are the symptoms of sexually transmitted diseases?
Usually, the venereal disease, most of the venereal disease will not have any symptoms. So the patients will neglect it. In some cases, there will be some burning sensation while passing urine. There will be some discharge from the unusual discharge from the vagina or penis.
Okay.
And there can be maybe some ulcers on genitalia.
Can it be a painful ulcer or a painless ulcer?
Yeah, usually it will be painless ulcers.
Okay.
So the patient will take
Seriously?
will not take seriously.
Okay. In your practice, what is the most common sexually transmitted disease?
It's in our Kerala. It's very few. It's very rare.
Okay.
So, but it's only herpes progenitalis and genital warts, gonorrhea, all are slightly common in our stage.
And what about this chlamydial infections in females?
Yeah, it's because of the good hygiene.
Okay.
It's very rare.
So how do you manage a sexually transmitted disease, and what are precautions that you ask the patient to take?
It's awareness. This is the first step. The patient should avoid sex with multiple partners and avoid sex with unknown person and have only one partner.
Okay. What about the contraceptive methods, doctor?
Condom.
So, doctor, we'll move on to the next question.
Yeah.
Hi ma'am, I'm Pinky from Dowling Healthcare. I have a doubt. Can a person get STDs from a virgin?
See, if the person is infected, even if she is virgin or not, she can spread that disease can be transmitted.
How, doctor?
There are different. I told now that even that mother can spread, that the baby can get the infection from the
mother
and the virgin. Other route of other type of anal sex. If she is having anal sex or oral sex, she can have the sexually transmitted disease.
Okay. So it's not
not only through the penetration of the.
It's not necessary that they should have after intercourse. They should have these diseases. They can have this type of diseases even after oral sex or anal sex.
Yeah.
So, doctor, we'll move on to the next question.
Yeah.
Hi, my name is Shika. I'm from Dublin. I have a doubt. Is sex is the only way to get sexually transmitted disease?
Sex can be transmitted, sexually transmitted disease or venereal disease can be transmitted through the blood to blood contact, skin to skin contact, or it can be spread from mother to child, baby, not only through the sexual act, vaginal or intercourse.
Okay. So what are the common sexually transmitted diseases that you come across?
Genital warts.
Okay. How do they present, doctor?
See, genital warts are moist, flesh-colored, cauliflower-like growth on the genital area, on the shaft of penis or inside the vagina or around the vagina.
Any other symptoms like other than this?
Some patient will be having some itching. That's all. They won't be having any symptoms.
Okay. What about other diseases? Like you said earlier, there are bacterial and viral.
Yeah.
So can you just
bacterial infection more common. It's gonorrhea is more common in more common. Okay. In gonorrhea there will.
Is it more common in females or males?
See, in females it will be silent. The symptoms won't be there.
Okay.
But in males there will be penile discharge, urethral discharge will be there, and there will be a slight burning sensation while he is passing urine.
Okay. So what do you mean to say that females can act as silent carriers?
Yeah, silent carriers.
Okay. What about the syphilis?
Syphilis, it's caused by the trypanosoma pallidum, and there will be ulcers. More commonly, a single ulcer will be there on the shaft of the penis. That will appear within 1 week of the sexual intercourse.
So when a female is diagnosed to have a sexually transmitted disease and she is pregnant, will it affect the child?
Yeah, that syphilis can cause transmitted to the child.
Okay. And one more doubt, doctor. Can we take this HIV as a sexually transmitted disease?
Yeah, it's a sexually transmitted disease only.
Okay, it's not transmitted through any other method?
Yeah, blood, through the blood.
We'll move on to the next question, doctor.
Hi ma'am, I'm Olin from Dublin Healthcare. Whom should one consult if they have a sexually transmitted disease?
Yeah.
She has asked whom to consult if they are suspecting a sexually transmitted disease.
A venereologist or a dermatologist.
Okay.
He will be a right person to treat for the sexually transmitted disease.
Doctor, is all STDs are curable?
No. Some STDs are curable, but some are not. Some STDs caused by bacteria, that is gonorrhea, syphilis, donovanosis, lymphogranuloma venereum. All these sexually transmitted diseases are bacterial infection.
Okay.
These can be treated with antibiotics, and it is curable.
How long do they have to take antibiotics for this?
It depends.
Okay. Is it a long term?
Yeah, long term. In some cases it will be long term, and if it is not severe, we can treat within a span of time.
Do they have to use any local antibiotics? Will it be like in the form of some ointments?
Topical
antibiotics, yes.
Ointments. No, we have to take systemic antibiotics only, oral antibiotics.
So
And some viral infections like herpes progenitalis, genital warts, that is caused by human papilloma virus, and HIV. These all can be treated to control the disease, but it's not curable.
with this human papilloma virus, will it lead to cancer?
Yeah, it will. Human papilloma virus is it's a virus.
Okay.
There are 80 strains of human papilloma virus. But in genital area, only some, for example, a strain human papilloma virus 6, 11 are acting on only genital, infecting only the genital area.
Okay.
So that will be causing the human genital warts.
So will
this will, in females, it can cause cancer to cervix.
Cervical cancer.
Cervical cancer.
So it won't affect the males.
Yeah, it will not cause the cancer in males.
Okay. So what are the non-curable diseases? I mean, sexually transmitted.
The genital wart is not curable.
Okay.
It can control, and herpes progenitalis is not curable. Viral infections are not curable.
I think most of the STDs are quite hazardous to health, I believe.
Yeah.
Like HIV.
Yeah, HIV. Even the syphilis can cause the cardiac problems and neurological problems.
Okay. Doctor, can you just tell me what is a herpes genitalis?
Yeah, herpes progenitalis is a viral infection caused by the herpes virus. The primary first it will be having some pain, that lesion. Then recurrent lesions will not have any pain or anything. It can
So that means only at the beginning the patient will have pain.
First time it will be
painful.
the recurrent it can recur.
Okay.
So in the recurrence the patient will not have any pain.
Okay. So how do they present to you, doctor?
The patient will be symptomatic now.
Painless.
Yeah, and he will be having a vesicle or some lesion on the tip of penis or.
Which lasts for a long period, or?
Yeah, it will be the patient will be having the recurrence. So when we are treating, that time it will subside. then again after few months or few years, he can the lesion will be that
He'll reappear again.
Yeah.
Okay. So what is the treatment? What is the mode of treatment?
That acyclovir, oral acyclovir is the drug of choice.
So when you're treating a person with herpes, do you have to treat the counterpart also at the same time?
Now, if she is also infected, then we have to treat that.
Here, doctor, you said like the patient will be always asymptomatic. So it's not necessary that
when the patient is having that lesion, that vesicle or what do you say? That lesion, painless ulcer on the tip of the penis, or then that time if he is having intercourse with his partner, that time only that partner will get that.
Okay. So is there any prophylactic medicines? Taking consideration to that, the male is already having an infection. When
the patient is having that lesion,
both of them should be.
They avoid sex.
By any chance, if we had sex, then do we have to treat both the
acyclovir, we can give acyclovir
to both of them.
Yeah.
Doctor, we are going to male. Hi, doctor. I'm a 35-year-old male. Got recently married. And for the last 2 years, I've noticed a genital wart. What should I do and whom should I see?
Genital wart is a sexually transmitted disease.
Okay.
For that, cryosurgery or chemical cautery, electric cautery, there are the mode of treatment we can adopt.
Doctor, what about this molluscum contagiosum? Is it a sexually transmitted disease?
Yeah, molluscum contagiosum is a viral infection. It's more common in children.
Okay.
But it can cause sexually transmitted. It can transmitted through the sexual intercourse in adults in genital area. It's molluscum contagiosum is a white pearly lesion with umbilicated
in the center. Okay, right.
Lesion.
How does it spread from one kid to another? One kid to another.
That I told you, it's a viral infection. That it will be spread through the contact only.
Okay. Skin to skin contact.
Skin to skin contact.
So what is the treatment you said?
Yeah, it's enucleation. That removal of the lesion, that white portion of the molluscum contagiosum should be removed.
Okay.
It's a superficial disease.
So there is no other topical agents or anything to.
Yeah, we can some trichloroacetic acid we can use.
Like for the topical use.
Topical application. That for chemical cautery.
Doctor, what about this tattooing and other dental procedures?
Yeah.
And this drug abuse, like most of them have taking drugs through IV injection and all. So how about that? Will it cause all this?
But if the tattooing, they are using needles.
Okay.
Okay. Then if the needle is not properly sterilized, or that instruments, surgical instruments or anything, syringe needles, if they are not
properly
sterilized, there are chances to spread HIV, blood
from one person to another.
Yeah.
Okay, especially through these needles and surgical procedures.
Okay.
So it's always better to have a proper sterilization of the
disposable
and
needles.
using disposable needles. So doctor, you have explained about the various types of sexually transmitted diseases. It was so informative. Thank you, doctor.
You're welcome.
So all infections in the genitals are not STDs. But if you leave STDs untreated, it can cause permanent damage. So if you have any doubt, write to us. Our email ID is youthdiaryroseball@gmail.com. So see you next week.